Hello, everyone. I'm Dr. Nishant Yagnick, and welcome to this wonderful interview session with Dr. Amartya Sengupta. He is this time Sinai AML 2 in CML rank 2 in neurosurgery. And welcome to our little, I call it podcast these days. It's so cool to call it podcast.
Yes, sir. Yes, sir. Absolutely. So thank you so much, sir, for having me here in your podcast. Yeah, it feels great, sir. Honestly, right off the bat, it feels really great to be here.
Pleasure's all ours, yeah. And where are you from, Amartya?
Sir, I'm from Kolkata, West Bengal.
Okay. And you've been
Yeah.
born, brought up in Calcutta?
Yes, sir. I've been born and brought up in Calcutta. I did my MBBS from Medical College, Kolkata, and I did my. I'm currently pursuing my post graduation in general surgery from IPGMER and SSKM Hospital, Kolkata.
Excellent. You have a very interesting. I have a batchmate who did his neurosurgery from IPGMER, and the
Yes, the
volume in
BIN.
that place
Yes, sir.
tremendous.
Hands-on is it's the hands-on there is tremendous, I would say. But again,
So, yeah,
volume.
there are volumes. I agree.
Yes.
Quality difficult to judge, but so I remember this is for everyone who's going to join neurosurgery. So apparently he told me, I don't know if it's better now. He says that there is only one staff and she's always circulating, or he's always circulating. There is no staff that gets washed with you in the case. So they'll put up
No,
the
no
I
staff,
don't
no
know.
staff.
Yeah,
No,
so
it's
they'll
like
just put up the
see,
trolley
yeah,
and
yeah.
give it to
That
you.
is what
Like, do it.
in sir. I would say in West Bengal in general, you like surgeons have to do a trolley. There is no scrub nurse who. No, I mean it depends on the department. In certain specialized departments like gastrosurgery, we do have scrub nurses who sort of scrub and get done. But when it comes to neurosurgery and like forget about emergency, it's all us.
Yeah,
It's all us.
yeah,
In like even MSGRs when they go for rotation, we do that trolley and stuff.
yeah.
And if we are lucky enough, we get to do some boreholes and stuff. That's it. Apart from that, it's all us. Just residents have to do everything. But
Yeah,
again, it's
we've
improved now. It's improved. It's improved a lot now. Lots of investment. Good infrastructure. We have a gamma knife right now. We have
oh, excellent. Yeah, it was wonderful.
yeah, we have a gamma knife. We do. We
Good,
have
good.
we have started stereotactic regular surgery. We started newer navigation as well. We have hooked up with Medtronic, so we have started all of
That's
that
ex-
now. Yeah.
that's excellent. Yeah, that's wonderful. So, Amartya, let's go through how you prepared for the challenges. So, just
Yes.
walk us through how you're still going to give your MS. You just told me your MS
Yes.
practical
I
is on
still have a
Monday,
practical exam left. Yeah.
and so nice of you to do the interview with us today. And
Thank you, sir.
so, what was your decision? When did you start preparing for neurosurgery?
Uh, so to be honest, my decision, I would say, I would like to share something. So I had the opportunity to get into the 6-year MCH course at AIMS itself when I was in during my NEET PG time. I mean, sorry, my INI CET time.
Yeah,
So I had the rank. I could have gotten in, but again, I was not sure about it. Let's say
yeah,
I was like 98% sure about it at that point of time, but there was this 2% margin of error.
yeah,
And apparently, I was told that if you have any sort of doubt, don't go for neurosurgery 6 years and stuff like that. So I would say I got a bit demotivated at that point of time.
yeah,
They're like,
yeah.
okay, fine, let's just explore and let's see. I mean, at the end of the day, I will always have the option of going back. That won't be a problem. So I explored it out, and now after everything, I realized that okay, fine. I definitely do not like. I mean, I have, liked every aspect of general surgery I've been through, but there is something about neurosurgery which is still very dear to me. So especially neuroanatomy, neurophysiology, neurology, in fact itself, and the
Yeah.
fact that it's very complex, and the fact that uh, one may get very, prompt results, if I can say that, especially because I've mainly been posted in the trauma department
Yeah.
during my neurosurgery posting. So I could see the prompt recovery of patients after decompression. So all of that
Yeah.
further instilled the fact that, yes, definitely neurosurgery would be something which I would do again and again if given the chance. So yeah, I decided finally it has to be neurosurgery. And so
So,
for that preparation, I would say uh, honestly, a solid amount of preparation. The focused preparation I did only for 4 months. I could only do it for 4 months because, like, yeah, I have a lot of other obligations as well. Ward
obviously,
duties, yes,
yeah,
and other like attending conferences and stuff involving MS studies and all. Because neurosurgery, honestly, is something which is not much touched upon during one's MS. I mean, it's easy. I'm not saying it's easy, but it's somewhat of known territory when it comes to GI surgery or maybe surgical oncology. But when it comes to neurosurgery, it's completely different. So one has to take a complete different route, and one has to balance both the things together.
Yeah.
So I've mainly focused on my MS portion initially, and then 4 months prior to the exam, say I started around August, I guess, not August, July. So what I did, I started with, like I said, I had Marrow right from the maybe from my second year. I used to use Marrow for my MS portion mainly. It was easy to sort of skim through the topics and all. And neurosurgery also I skimmed through very quickly because videos are very, I would say, very lucid, very concise, and they give the gist of everything. And it's very effective, I would say. It covers up your basics and sort of makes, I would say, sort of gives you a baseline, and then you can improve and add more bulk to it, right? So thereafter, I would say I tried studying Greenberg, the relevant portions like neuro-oncology, trauma, infections, and general neurosurgery, especially.
Yeah.
All of these high topics, I tried reading from Greenberg, and I did that about maybe it took me 20 to 25 days to just have a quick run through with respect to Greenberg. After that, I would say I started focusing on grant tests. So that would be my main strategy thereafter. Focusing on grant tests, giving frequent grant tests, increasing my frequency. Say initially I used to give maybe 1 or 2 grant tests in a month, and then I increased that frequency maybe once or twice in a week. And in the month, say about 20 days prior to the exam, I increased the frequency to maybe about 1 grant test every alternate day, as much as I could get from all the sources. So I would say I completed about 18 run tests in my last month of preparation. So that I would say the main difference maker was, yes, my the habit of giving run tests. I can't emphasize that more. I've like emphasized that I've been emphasizing that ever since my NEET PG days. Keep on giving run tests.
Yeah.
So that what it does is it gives you an idea about where you stand, and also gives you a clear insight as to how much more effort you need and where are the areas that you're lacking. So you could get a very bird's eye, a very crisp sort of a bird's eye view regarding that, and then you can further build up on your preparation. With respect to QBank, solving QBanks, I would say I solved almost all the modules in neurosurgery. Almost all. Maybe I couldn't do a couple of, or maybe 3 or 4. But apart from that, especially the atypical topics like functional neurosurgery, epileptic surgery, stuff like that, which is I honestly didn't register initially, but after repeatedly going through it, trying to like sort of analyze it and all, it worked really well. So those tricky MCQs, which are somewhat on like on the harder end of the spectrum, they are also covered.
Yeah.
So I would say a perfect mix of using the Q banks and frequent grand tests, and at least 3 revisions prior to the exam, I would say should be sufficient. I could only personally complete only 2 revisions because I had to juggle between. I had to constantly juggle between my MS and my INI SS preparation. So even two can work if you have really gone through it very seriously right from the go. Or I would say 3 revisions should suffice prior to your theory exam. And definitely for the part 2, that is the departmental assessment exam, I would say the mock interviews really helped. Especially I think you and one of your friends, you conducted a session. It was so very. I mean, it was very informative about. So
The recent one, right? With
yes, the
Popular
recent one
Praneeth.
with yes. It was so. It was actually like it really provided a keen insight because sir is I think from AIMS Delhi, and so you're from PGI, and so I mean who else would know what goes on in an INI better? So that was really an eye opener, and sort of I basically knew what they would be asking me. So again, tell me something about yourself. Why would you want to take neurosurgery? And here are some OSCEs. Go ahead and answer as much as you can. That was the format. So again, that gave me some sort of a preparation, some sort of heads up as to what to expect. And to sum up, I would say revisions, grand tests, and getting the habit of speaking, because that's important for you. If they will realize that you know stuff, you don't have to answer all the questions, because honestly I could only answer only 3 questions because the time limit was very short and I was at the tail end of the spectrum. So I was supposed to start at 2:30. I started at 6:30 p.m.
Oh God.
Yes.
Oh God.
Sir was there. I think Sir was there. So was conducting my interview. I think Shashwat sir was there most likely.
Okay.
So yeah. So it was very right at the bat. I was very comfortable because the way he approached everything and all, it was very relaxed.
Right.
But again, I had very limited time, so I could answer only 3 questions. And then I realized, okay, I have answered in 3 questions, and I could see the slide share part that they have so many questions lined up. And I panicked a
Yeah.
bit after. Honestly, at that point, I was like, okay, I shouldn't have wasted. I tried to elaborate on answers a bit initially, so I couldn't
Yeah.
complete more. I was so I sort of panicked at that point. I was like, okay, fine, I couldn't. What would happen?
Mm.
But then I realized that they gave me 15 out of
Yeah.
20. So
No.
I would say the way you approach, the way you speak, that is what is important. They will know that yeah, this guy knows something. Maybe
Right.
0.15% that at a
Right.
beginner's level. So
Right.
that is what is important. Get in the habit of speaking and just shake off your shackles and just be free. That's it.
Amartya seems to have put it very as if, it's like so easy. I mean, you did a splendid job. Imagine what you've done in 4 months. You've done the lectures, you've done relevant parts of Greenberg, you've done test and discussions, you've done all the modules, you've done grand tests alternate day, which is really something because it's, you get, if you can't solve the grand test, it hits you so bad, you don't want to touch one for the next 1 week, but you've done it. Then you've done the interviews, and I've seen some surgeons who make things that look so easy, but then when you go do the same thing yourself, you realize,
Yes,
oh my
it's
god,
very
how is it? So Amartya is like that. He's going to be one of those surgeons that makes things look very
no,
easy.
sir, nothing of that sort. Also, sir,
So but
obviously, like what has been going on in West Bengal for the past couple of months, that was really
exactly, so that I was about to
that
come to that.
really took a very like heavy
Big
toll
toll,
on everyone's mental health.
I'm sure.
It was very difficult, honestly. It
Yeah.
was very difficult to concentrate and all,
Yeah.
after what happened. So honestly, I mean, we had to. It was not like situation was not that you just sit at home and let the protest and do everything continue. You have to go there, you have to be
Exactly.
a part, do
Exactly.
everything. I mean,
You
whatever,
should.
how
It's
much you can
totally, yeah.
contribute, and that's it.
Yes, definitely, definitely. I was
It's
about
not
to come to
easy.
that. You did all this despite giving support to
Yes, sir.
what is an extremely essential
Right.
issue that
Right. So well, I think it's important to be conscious about one's moral responsibilities as well,
definitely
not
and
just
speak
be
for
selfish.
the community.
So again,
Not
I
just
have to,
not
yeah,
just being
like I
selfish. I feel it is not just a responsibility. We need to band together to.
yes, right,
If you don't band together and don't, you'll become a neurosurgeon. Na? You'll realize by the end of 3 years why they consider why everyone is like always a bit scared of neurosurgeons because
yes,
we fight for our shit. Like we
yes,
fight
sir.
for our
Definitely.
patients. We
Yes,
don't
I
take
like.
things casually.
Yes, sir. Like every patient is our patient. I wouldn't get anything. I wouldn't like to listen anything from an anesthetist or any other person regarding my patient's management. No, I will do that myself.
So same
So
thing.
that is
Our doctors are our doctors, man. If something goes wrong with our doctors or something, we fight for our doctors. We fight for our juniors. We
exactly
fight for our batchmates, our seniors,
whatever
everyone.
I could. I tried my best, whatever I could, and
It's
apart
good.
from that,
It's wonderful to know.
at the same time, so sadly, life has to go on as well. So you have to juggle both. So
Yeah,
I tried
definitely.
my
Yeah, you're
best,
into
and
that
then
kind of a program.
slowly it started clicking, and sort of I shifted gears, and then I could complete. Luckily,
No, that's wonderful. And I think what you've described is actually a very, very beautiful way of putting what I have learned also from people's journey that I've been following now for the last 2 years in terms of
yes,
how they should start and how they can conclude. And
yes,
people have different learning curves and different times of starting. But
yes, sir.
definitely lectures, Greenberg, because Greenberg by itself is very dry and very difficult to comprehend.
Yes, sir.
So lectures,
It's very dry,
Greenberg,
honestly.
and then testing and then retrograde. What you said about the functional and epilepsy is exactly right. You they're very large topics that are very difficult to understand, but the coverage is very variable. So you might get a lot of questions, you might get no questions from functional.
Yes,
It
sir.
depends on how interested the person
This
making the
time we
paper
had
is
the
in
three or
different.
four questions. We
Yeah.
had 3 or 4 questions this time from functional neurosurgery, but they were common ones, frequently asked questions. So nothing new in that.
And if there's an MCQ that has come out, you should know the answer. Essentially, that's what I keep telling people that if it's
Yes,
come in a grand test, if it's published in a book, you should, even if you don't know the explanation, at least know the answer, more or less.
yes, sir.
That will really help
Yes,
you
sir.
eliminate joy.
Past,
Okay,
past,
right.
past year topic, past frequently asked MCQs, one should know. Again, in that case, I would say I did make a couple of mistakes. I would say I was not at my peak that day, so I did commit a couple of mistakes, but I was
I'm sure
lucky.
you did.
Yes.
Luck is just part of it. I think there is a basic level of preparation beyond which luck
Yes,
works.
sir.
Without that basic level,
Yes, sir.
nothing works.
Yes, sir.
It's
I
the
will say that.
day. And so, tell me about your interview OSCE. What are the kind of questions that came on the OSCE?
So first of all, there is nothing to worry about the OSCE. I would say the OSCE is the secondary part. They would just assess how you approach a patient, how you approach the case. Even if you don't
Right.
know the exact answer, they will help you out. They're very helpful people. I mean, I don't know. I don't think there is any point to be scared, unless yes, of course. I mean, depends on who is taking the interview. If it's Kale sir or
Yeah.
it's someone else,
It's
it
fine.
obviously you would feel
My
far
interview was
much
taken by
fine.
Dr. Kale. He was okay. He was not that bad at all. It's Suri and
Yes,
all who are a bit tough. So, basically, so they did ask you about your experience in because many people are bothered about
yes.
that, right?
They
Experience.
just asked me two questions. Tell me something about yourself and why would you like to take neurosurgery? Simple questions which I always ask. There's nothing new in
Yeah.
that. And then simple OSCEs. I would say very simple OSCEs.
Examples,
Something
images, which images?
if I could remember, maybe vestibular schwannoma. They gave a picture.
Okay,
They were MRI image of vestibular schwannoma,
good.
and they asked me to, what is. They had three questions under that. That
Right,
identify, and
right,
what would you do, and what is the what is the investigation of choice, what is the treatment of choice? Simple questions, and you can move forward.
right.
And another one was maybe D. Alonso, most likely type 2,
Classifications.
yeah,
Mm.
either the
Odontoid
base of
classifications. Mm.
right body of frontal fracture. So
Mm.
simple questions, cases which are very frequently we come across in neurosurgery OPDs or maybe in trauma scenario.
Yeah,
SDH, chronic SDH. It's very
right.
simple questions. So nothing.
Good.
There's nothing to be worried about the OSCEs. I would say it's about how you answer. I would say be crisp, be to the point. Don't beat about the bush. And it's obviously because you will be wasting your own time.
That's
Try
great.
to be
That's great. That's very good advice. Yeah.
try to be concise. Very few sentences. Don't invite trouble by adding unnecessary stuff. Like I would say in my case, I mistakenly said investigation of choice for vestibular trauma would be a 3 Tesla MRI with gadolinium enhancement. They're like, who told you this? And you know how expensive it is to get a 3 Tesla MRI done. I mean, luckily we have a 3 Tesla MRI in our center. That's why I could say
Yeah.
that. But
Yeah.
apparently it's not needed. 1.5 is
You don't.
sufficient. So
You just say MRI.
just MRI.
Otherwise, they'll start asking you what is the difference between a 1.5 and a 3 Tesla. And
Exactly,
honestly,
exactly,
even
exactly.
I don't know. I think it has a coil density thing from what I
It's
read
like
a
a
long
coil
time
density
back.
thing, yeah, something
Yeah,
like that.
but
Mm,
don't get it. Like
exactly.
they'll pick
So
because
that is
they're
the thing.
bored, right? So by the time they
Exactly.
get to you, they're
Honestly,
bored.
they're bored. It's like I could realize that it's something somewhat similar to when I conduct OSCEs for my undergraduates during the undergraduate
Yeah,
exams. Like, I'm sitting with my professor. I'm like, हाँ ठीक है, बोल दिया काफी अच्छे. So that is the
exactly,
thing.
exactly.
I
Yeah,
they're after they're tired. Na, they're taking so many interviews with so many patients. They have been doing this
that's
twice a year since I don't know how many years. They know what you
exactly.
are. So there is no point of just bullshitting about over there. It's like there's no point. Just
Yeah.
be open, be frank, and keep whatever you say to a minimum so that you can avoid
Okay.
trouble and so that you can answer maximum number of questions. And also,
Can you
don't.
recall? Yeah, please. Go ahead.
Yeah, one more advice is be specific and to the point with respect to the question that is asked. I mean, in this patient,
Yeah,
what will you do in this patient, not in some other patient with this and that. Just answer
yeah.
that and move forward. They will help you actually. They will help you speed up.
Good,
So
good.
nothing to worry about the interview. I would say the main determining factor would be the part one, because
Yeah.
honestly, that is essentially what ensures your ranks.
And
Unless
coming
I
to
said
that,
neurosurgery, I don't know about any other discipline. I'm not sure, but for
yeah.
neurosurgery, I would say it's very fair. They conduct the exam in a very professional and excellent manner, I would say. And I was really happy with how they conducted everything. It was very smooth.
Coming to that, can you recall a few of the harder questions from your part one, your
I wouldn't
paper?
say there were any hard questions. Whatever I faced, it
Okay.
was simple and straightforward. No hard questions, I would say.
No real hard
But
questions.
I mean,
No
there might.
operative.
I said there could
Because
have been other questions. There could have been other
yeah.
questions, but I couldn't get to those questions because of the time limit.
Okay. All right. So
Yeah.
there. What did they ask a lot of operative this time? Because last to last exam, they
From
asked about
whatever
pretty
I
much things.
Yeah, like operative, essentially the treatment. They asked what is the
The treatment.
treatment in vestibular schwannoma. What we in this, it's a huge vestibular schwannoma, maybe a Coase grade 3. Which approach will you use? So
Mhm.
yeah, just name the approach.
Yes.
That's it.
Name the approaches. So
Name the
pretty
approach.
standard this week. That's very good. They gave a very balanced one. Actually, the last
Very, very,
to
very
last
bad.
time they was too easy, and then the general surgery was very hard, and then last time they made the neurosurgery very hard and the general surgery very easy, and this time
Yes, sir.
hopefully they've done a very
It was
balanced.
balanced. The paper was balanced. I would not say it was easy. It was
Yeah,
moderate, definitely. And the questions were a bit, I would say, repeated questions from maybe past year, frequently asked topics. I mean,
yeah,
relevant topics, definitely. Nothing unheard of and nothing out of the box. They asked very practical, very relevant questions. And again, options, maybe a couple of options would be tricky, as is expected. It's very normal. So,
right.
and general surgery this time was, I don't know. General surgery appeared to be easy, I would say. General surgery was
Okay,
on the easier.
good,
Now, this
very
is
nice.
how I felt. I'm not sure whether it was exactly so. That
Yeah,
was, I would say, it was a very balanced paper this time. Even the interview was very balanced from neurosurgery.
excellent, excellent.
Overall, I really enjoyed it.
Or what? Excuse me.
Overall, I really enjoyed it. I mean,
Overall, you enjoyed it. I'm so glad you
the
enjoyed
experience
the
was very good.
process. This is very encouraging to a lot of people that they should enjoy the journey.
Yes, sir.
So, one more thing. How much do you think the lectures directly contributed? If you just see the lectures, how much percentage of the questions would you be able to answer? Very honest assessment. Please let me know so that we can work on our
Surely, sir.
lectures.
Sir, um, I would say certain topics, like those difficult topics, uh, all of those videos have all the frequently asked questions and very commonly asked
Yeah,
questions in there.
yeah,
Uh, Apart from that, I would like to say a bit of more content in when it comes to neuro-oncology and vascular neurosurgery would be a bit better, because
right.
uh, and general neurosurgery. I mean, the first few chapters of brain work, which is
The
like
first which brain work.
very dry and brain dead. I mean, it's very difficult to read and revise.
Right.
Uh, Brain dead, the coma. I think the videos named coma, right? In brain
Yeah,
death and
yeah,
coma.
yeah,
That's what
yeah,
that's very well updated and well produced video, I would say, which has all the points from Greenberg and all. But
yeah.
a bit more content, honestly, I would say, when it comes to neuro-oncology and vascular
Right.
neurosurgery. But again,
That
when it comes to videos, you have to supplement it with the Q bank,
with a question back, definitely.
with the question. You
So
have to.
we are planning to redo all the videos with updated content over the next year. So this would be
Yes,
very good feedback for us because I'm trying to make it less dry by putting in operative videos within. Initially, I was going to do a series. I've done two lectures on just operative, but
yes, sir.
we're planning to include my own personal operative videos and those contributed by people I know within the lectures to make it more interesting. For example, if you're
Yes,
studying
and
MCA, you need to be able to see what the MCA looks
yes,
like
sir.
in operatively.
Yes,
So that
the
really helps.
intra-op images, actually, like how exactly it's
Drop images.
approached, what is the view exactly during the operation. It's so I used
True.
to, in order to sort of get a, general idea. AIMS has a very nice channel, Nets AIMS, I think.
Yes. Yes.
So they have all
Definitely.
the videos, they have all the lectures from all the giants in the field. So I used to
Yes.
just
Yes.
try looking up those videos. I mean, I couldn't understand maybe 50% of
Hey,
what
but
they used to say.
at least you're right. When you come out of your MBBS, you've not seen the neurological exam for a good 3 years, 2.5, 3 years. You've
Yes,
not
sir.
done anything related to it, and
Yes, sir.
suddenly you're pushed back into MBBS territory, especially in the first parts.
Exactly, sir. The
Being
first,
able to being able to look at it is it keeps you inspired that okay, this is actual shit. This is not like it's we're not talking about just theory or concepts. This stuff actually
yes,
matters, right?
I would say the most important part of neurosurgery would be actually neurology. Without neurology, you don't know anything about neurosurgery. It's pointless to go about reading,
Yeah,
about operatives and this approach and that approach. But you should be able to diagnose a patient with say a focal neurological deficit or maybe pupillary signs. These things, a raised ICP. These things come first. Managing a patient of maybe status epilepticus. Only after that you can go ahead with hi-fi stuff with approaches and stuff. So again, but nonetheless, I used to try to see some videos regarding the same, like maybe a Dolenk approach. Lots of videos on Dolenk approaches on
right.
that channel. So again, I do have some amount of interest in skull-base surgery as well and vascular neurosurgery. So it's just out of
So you'll see after just you know what, and you were saying now you're a bit demotivated taking the 5 years course. That is not a wrong decision, by the way. Please don't feel that you're demotivated. I feel that it was a very practical decision. It takes great courage to leave an AIM seat to join an MS, knowing that you have to give an exam again, that's actually a very courageous thing to do, because many people compromise on that, saying that, "Chalo, ek life to set hogi, we'll deal with it." But you didn't settle
My
for that.
story
That's
is a bit
very
more complicated actually. So
good.
I don't know.
Yeah, do let us know.
I think we should skip that in this part of the
Chalo,
recording.
ठीक है. we'll,
I will
we'll
say
talk
that
about
after
it first.
we should
After the recording is over.
yeah, I have to
Yeah.
share this. I have to share this.
Because for me, after my MS, in my I had what 15-day neurosurgery posting. What do you see in that? I
Yes, sir.
joined Loknayak Hospital as a non-academic SR in neurosurgery just to see what this is.
Yes,
Because
sir.
once you're dedicating yourself to something for your whole life, especially with such a hectic branch, you want
Yes,
to
sir.
see what it is. So it took me
Yes,
a
sir.
good 6 months. Yeah, 6 months for me to make up my mind that yes, this works. And it was very depressing in the beginning. One more thing, trauma and all is fun in the beginning, but it's really what you're saying. This I'm a skull-based person, so it's really the patients who walk into your OT, and if you can
Exactly.
deliver them well, walking out,
Out.
that
That
is
is
the real trick.
exactly.
A patient coming in I always feel that emergency neurosurgery, and this is for everyone to know, emergency neurosurgery is actually legally and mentally a very safe practice. It's safer than even a gallbladder. If you do
Yes, sir.
gallbladders and if something goes wrong and there's such a lot
Yes,
of
sir.
volume, there are 5 people in your apartment who've had it done and who will badmouth you about
Yes, sir.
to the patient that, this, my mind went very well. If a patient comes in M3, either the patient becomes M1, then you've tried your best. Patient becomes M6, you're gone. But
Exactly, sir.
yeah, recently I did a 11-year-old child with a congenital myelomeningocele with the third cord with a sinus who presented at 11 years of age, no
That's
deficits, but severe pain and burning.
right.
And no one was able to touch the guy. And the phylum terminal was difficult to identify, and it was
Mm.
going into a large lipomatous sac that was extending into the skin. And I had the
Mm.
plastic surgeon do the cover as well. And
Mm.
the patient turned out to be
Right.
wonderful. But until the patient came out of anesthesia and moved and did not have a urinary incontinence, it was my heart was constantly okay, okay, okay. So it is that is neurosurgery. Like if you really want to know the
Exactly.
thrill behind it,
Yes, sir.
high highs and low
High
lows,
lows. Yeah, low lows. Yeah.
low
Yeah,
lows.
exactly. Because see, in our case, we have a trauma center. There's the
Yeah,
only trauma center in entire East India, the largest trauma center.
yeah,
So usually, what we do, we are pooled together with neurosurgeons, plastic surgeons in the same trauma bay.
yeah,
So, and the first, actually, the one benefit we have is that the first specialty to attend a patient is irrespective of what trauma it is a general surgeon. So
right.
we have to clear a general surgeon like a head trauma patient that he has no evidence of any abdominal trauma or anything, and only then we can like they could forward it to a neurosurgeon. So
Yeah,
again, at that point, I used to like try to see, just try to examine the patient, just checking his Babinski's and all, say checking his
yeah,
pupils. Let's see if I can sort of deduce. I used to look up the CT scans. I mean, I just initially my target was just to see whether I can make out something white and something dark
good,
in the CT one.
good, good.
That's
Very
it.
nice. Yeah,
And so that's a basic thing. Like there's a hemorrhage or not. First thing I would like to rule out, and then we can go on. So
you
I
can
used
go
to
on.
do that right from the start because I had a knack in
Good.
neurosurgery. Then when I went to my went for my postings in general, and during my second year of general surgery,
Yeah,
uh, again, I was posted in trauma because it's not possible to go to the main or elective OTs during my postings because I'm
yeah,
always posted in trauma.
yeah,
So again, during that time, I would see my SRs, counseling the patients that there are two things: either the patient, firstly, the patient's condition is bad, simple,
yeah,
and second, the
yeah.
patient may not. The first two
May
things
not
that you
be.
have to say. I like,
Yeah,
okay, this sounds a bit safe. So
yeah,
okay,
yeah.
this sounds really safe. And then I used to
Exactly.
like watch them do decompressions. They even helped, like made me do a couple of decompressions myself. So
That's wonderful.
it was a really good experience. So that is what hooked me onto neurosurgery even more, I would say.
Great.
And
But
I am like I'm all for the thrills, and I know these 3 years at least a couple of years. The first year at least it will be tough, obviously, because I mean, okay, we have been through first year
no, no,
general surgery,
it's
and it's
going to
tough as
be
well.
it's a different kind of tough. You start
Yes.
if you're going to enjoy your exam process, you're going to enjoy your residency. It's a very different. You need a lot more EQ than you need IQ. So I have
Yes.
seen a lot of very brilliant, including some of my batchmates, academically brilliant people who just quit because it's the really brilliant people who who don't have what I call the Trump brain. They need the EQ to be able to bear all the stress and all the politics and all the stuff. That's in every department, but in neurosurgery, it takes a different role. You'll realize why. There is a reason why it is. We kind of own our
Yes.
patients. We
Yes.
Every single thing we believe goes wrong with our patients is our fault, and therefore, by
Well,
extension, everyone else who works for us
yes,
kind of
involved is, yeah, their fault. It's okay, sir. I know. It's like I won't remain a resident for the entire life. It's 3 years. I just want to learn. I mean, I'm
exactly,
looking at the positives. That's it. I'm here to learn. It's okay. I'll make mistakes.
exactly.
It's a part and
Yeah,
parcel
yeah.
of life. It's okay.
No,
No
you
matter
don't
how
make
much
mistakes.
things and how much
Don't beat yourself
I
up.
get shouted at,
And
I'm
listen,
fine.
anytime in during and this is for everyone who's listening, whether ultimately you're going to make it into some residency program, any point of time you feel that things are a bit much, that you're not able to understand, that you feel personally and intellectually insulted, you are free to reach out to me. You're free to reach out to myself and a huge community of people who've been through it, both in the public sector and the private sector, and we are here for your support. It's a very supportive group of people and organization. It's just your immediate seniors and the professors who, and once, believe me, it's once you come out of there, even they will be very supportive. They'll throw, you'll realize new light on what their actions was. So that's for you also, Mate. If you ever feel,
Yes.
and what's your choice here? That's the big question. Where you going to go?
Um, Hames Delhi.
Name's Delhi. Good, yeah. Keep in touch. Huh? I mean, I've become head in Fortis Manesar, so I'm going to be here for a while. So keep in touch. And
Yes, sir.
anytime you have a problem, Praneeth was nice enough to even give his phone number on the chat.
Yes, sir.
So
Yes, I did. I have sir's number saved with me. Right, sir's number.
yeah,
Yes.
so Praneeth will give you the ins and outs of
Yes.
everyone. And other than that, another person, Dr. Raghav, his Raghav Singla, he's my batchmate. He was in AIMS as a assistant professor. He's joined Paras right next to me, and so we have a huge community of people who are AIMS, ex-AIMS, and those guys who will always support you. So we are always there for you. All right. And
Okay, sir.
any last great advice for our for the next people who are coming up?
I would say at this point of time, we are all, I mean, from a surgical point of view, we're all surgeons. We're all general
Yeah.
surgeons. So there is nothing to be sad about if one's not able to clear, you know, the first attempt or maybe subsequent attempts. We're all general surgeons by now, and we are not MBBS students. So we are not people who are wanting to get into PG and all. So I think
Yeah.
one should not take the results with a pinch of salt. It's just a matter of when. It's not.
Yeah.
It will happen. Obviously, it's just a matter of when. So nothing to be sad about, nothing to be worried about. Just go back to your roots, see where the problem lies, and just correct it. That's it. I mean, there's nothing to be disheartened about. You have a life ahead. You have a family. I'm sure you're most of the
Exactly.
people will be earning a lot. That is the most important thing. You will have money at the end of your day. So
Yeah.
there's nothing to be worried about. You have a lot. You have lots to give apart from just saying entrance exam. It will
That's
happen.
wonderful. Wonderful advice.
Yeah.
Plus, if you're going to do something the rest of your life, it's going to be today. It's going to be your MCH program. Tomorrow it's going to be your fellowship of national board. Then
Correct.
it'll
Yes.
be some fellowship you would
Something
do
or the other
outside,
turns
which you
up.
may or may not get.
Exactly.
Now you're in it. If you're in it, you're in it in every different stage. So please
Yes, sir.
don't feel that if you don't make it now, once you decided that I am a neurosurgeon, then you go through all the motion. And some people will do it. Some people will be assistant professor for 5 years, then come out into the private sector. Some will go on to professor. Some will go on directly to the private sector. Some will
Yes,
go to
sir.
their hometowns, make a big hospital. Some will work in a
Yes.
corporate. And everyone has a different trajectory based on what they want. So you're very right. It's once you've decided in your mind that you're going to do neurosurgery, and you're a neurosurgeon, it's just a matter of time. And
Yes,
you're going to make it
that's
definitely.
it.
And wonderful, yeah, Amartya. You seem like you're very sorted,
Thank
and
you, sir. I
so
hope
nice to have
I
you.
remain sorted. I hope.
It'll be sorted, yeah. Don't worry. You seem sorted. And you seem
Yes, sir.
ready
Just want.
for the residency. And so, and your advice, I think, is very astute. What I like about it is, I feel that you've really
Thank
encouraged
you,
people to follow a certain chain, especially within 4 months of exam, especially while doing your MS, especially under the circumstances that were happening in West Bengal and the rest of the country. Those,
thank you,
given all of that, I think it's a tremendous achievement.
thank you
So,
so much.
thanks for being here, and thank you for your feedback on our lectures. We are going to work strongly towards making them more and more comprehensive as and when the patterns have started to change. We've noticed
Yes, sir.
over the last years. Right.
Yes, sir.
Great.
Yes, sir. Thank you
Thanks,
so much,
Amartya.
sir.
Thanks a lot. Yeah.